Chapter 8, Patient Assessment. This is the introduction. The importance of patient assessment cannot be overemphasized. EMTs must master and be comfortable with the patient assessment process. Patient assessment is used, to some degree, in every patient encounter. EMTs develop and perfect their own assessment techniques as they complete their re-education and education and gain experience in the field. This chapter provides the framework and information necessary for you to be able to understand and conduct the patient assessment process. The assessment process is divided into 5 main parts, the first being scene size-up, the second, primary assessment, the third, history taking, the fourth, secondary assessment, and the fifth, reassessment. Although the steps of the assessment process represent a logical approach to evaluation of a patient, the order in which they are performed is dictated by the patient's condition. For example, the same components of patient assessment used to evaluate a medical patient are used to assess a trauma patient. The same components of patient assessment used to evaluate a medical patient are used to assess a trauma patient. The differences lie in your findings and how you effectively care for your patient. Whether you are assessing a medical patient or a trauma patient, the key in both situations is to remain organized. The key in both situations is to remain organized. Rarely does one sign or symptom reveal to you the patient's status or underlying problem. Rather, it is a combination of many signs and symptoms that reveal the underlying problem or condition of your patient. A symptom is a subjective condition that the patient feels and tells you about. A sign, on the other hand, is an objective condition that you can observe about the patient. A symptom is subjective and a sign is objective. Therefore, it is essential to have a basic understanding of the causes and presentations of emergencies so that you know what to look for. For example, a man with chest pain may be having a heart attack, or he may have a lung infection, a pulmonary embolism, or a simple strained muscle in the chest. He may also have sustained chest trauma. He describes the pain as crushing, radiating down the left arm and up into his jaw. He is pale and soaked in sweat. The episode began while he was shoveling snow, and he has a history of coronary bypass surgery and has nitroglycerin in his pocket. On the basis of this information, your assessment should lean toward a diagnosis of myocardial infarction. That's an MI. In this example, you can see how it is essential to collect all pertinent information and be able to interpret how it fits together. The patient assessment process is the ground on which all levels of EMT are built and is the foundation of all patient care. EMS providers cannot effectively treat their patients if they cannot assess them. A strong foundation will assist you in the process of saving lives. Scene size up. Page 255. When you are alerted for an emergency call, your dispatcher will provide you with some basic information about the situation that requires your assistance. Your scene size up begins here. The scene size up is how you prepare for a specific situation from the moment you are called into action until you finally reach your patient. You must consider a variety of things that will have an impact on how you begin to care for your patient. The scene size up includes dispatch information and must be combined with an inspection of the scene and help you ensure safety and identify hazards, safety concerns, and the number of patients you may have, as well as additional resources you might need to safely and effectively care for the patient. Ensuring scene safety. The pre-hospital setting is not a controlled and isolated scene. It is unpredictable, dangerous, and unforgiving, and the outcome could be less than favorable. What seems relatively safe and secure can turn bad without notice. Every pre-hospital scene has the potential for injury, and if you or your partner become injured or incapacitated in such a way you cannot function at the emergency, you have taken away the initial resource the patient needs. You need to ensure your safety first and that of your patient second. Let me say that again. You need to ensure your safety first and that of your patient second. Safety. This begins by wearing, at a minimum, an American National Standards Institute 207 certified high visibility public safety vest. The vest provides you appropriate visibility while minimizing interference with other clothing, and equipment that you may have. Look for possible dangers as you approach the scene, and before you step out of the vehicle, observe unstable surfaces, slopes, ice, water, and wet grass. Remember, you have to gain access to a patient, but typically the way you enter an area is also the same way you will leave. When you leave, you will be moving up to a 100-pound stretcher, if it is motorized, and possibly a man weighing 220 pounds or more. If your footing was compromised going in, you are going to have an even more difficult time coming out. Consider traffic safety issues and issues related to the scene safety and vehicle rescue. That's an accident scene. Do not enter potentially dangerous scenes until a professional rescuer, like firefighters, utility workers, hazardous material technicians, or law enforcement personnel, have made the scene safe. Consider your ambulance a safe haven when caring for patients. Park your vehicle in an area far enough away, but in a place that allows you rapid access to equipment and your patient. Consider environmental conditions at the scene. In other words, take into account the location of your patient may be outdoors, indoors, or in a public place, and thus subject to a wide variety of conditions. You are obligated to provide protection for the patient. Is it cold, snowing, raining, or humid? Are there numerous onlookers at the scene? Consider these factors. Some areas of the United States can be covered with snow and ice for 4 months during the year, and other areas may have persistent periods of rain for 6 months. You may be aware of the weather and prepared for it, but also consider the physical terrain, such as mountains, wooded areas, gorges, bodies of water, rivers, lakes, streams, and islands. A significant portion of the United States is covered by hills, mountains, and sand. Therefore, a good possibility exists that you will be faced with challenging conditions and decisions. See Figure 8.1. Working in unfavorable conditions and in unstable surfaces is a large part of the pre-hospital care. Without knowing the infinite number of situations you may become involved in, a good rule to use when faced with a wide variety of possibilities is that any actions you may take to protect yourself, heavy coat, rain gear, life jackets, air-conditioned or heated vehicles for that matter, should also be considered for the patient. If you are putting on equipment to address environmental hazards, provide the patient with the same or similar equipment. If you move away from the scene to take cover from an environmental hazard, move the patient with you. Taking your time to stay focused on what you are doing will go a long way in preventing injuries to yourself and to patients. If appropriate, help protect bystanders from becoming patients as well. Many bystanders attempt to help during an emergency. Always remember that they are not trained to handle complicated EMS equipment, illnesses, or injuries. Page 256. Hazards come in many different forms, shapes, and sizes. Chemical and biologic hazards, electricity from down to electric lines or lighting, water hazards, fires, explosions, and potentially toxic environments containing carbon monoxide are just a few hazards you will encounter. Information that may help you determine potential hazards can be provided by dispatch. For example, you may be sent to a motor vehicle collision involving a semi-truck carrying hazardous materials, or to the scene of an industrial site that produces chemicals, or even to a private residence that has an animal that poses a threat. See Figure 8.2. There are also hazards found at every motor vehicle collision scene. Consider the traffic that is moving around the crash scene. It is also likely that fluids are leaking from the vehicle. Antifreeze, oil, and gasoline are common chemicals found at a scene. When they come in contact with the roadway, it can make for a very slippery surface. As you walk on this surface with leather-soled shoes, the oil and asphalt make for an extremely hazardous surface. All of these examples may be relatively obvious, but be aware of the dangers that may not be so apparent. Occasionally, you and your partner will not be able to enter a scene safely. If the scene is unsafe, make it safe. If this is not possible, don't enter it. If the hazard presents a substantial risk to your health and safety, you should request the appropriate assistance. If the scene is a potential crime scene, follow local protocols before entering. Ask for law enforcement personnel to accompany you when needed. See Figure 8.3. On occasion, You may enter a scene that appears safe but quickly becomes unsafe. If this situation presents itself and you have the appropriate education and training to make the scene safe, do so. If not, be prepared to extricate yourself and your patient as quickly as possible, protecting the patient from further injury as much as possible. Be aware of scenes that have the potential for violence. You will encounter violent patients, distraught family members, angry bystanders, gangs, and unruly crowds. When you enter the home of a patient, look around the immediate area. Are there weapons visible in the area to which a patient or others may have access? Weapons need not be typical like a knife or gun. They can also be items such as a screwdriver, a hammer, or simple things sitting on a kitchen table or nightstand by the bed. Always be observant for such objects, and if they are not secured, make sure that you place yourself between the patient and the potential danger, thus preventing possible access to the object. Request the assistance of law enforcement personnel if the scene is unsafe with the potential for violence. Determine the mechanism of injury and/or the nature of illness. The mechanism of injury or the nature of illness. As an EMT, you will be called to motor vehicle collisions or other situations in which patients may have sustained life-threatening traumatic injuries. Traumatic injuries are the result of physical forces applied to the body. To care for trauma patients properly, you must understand how traumatic injuries occur, or the mechanism of injury. With a traumatic injury, the body has been exposed to some force or energy that has resulted in a temporary injury, permanent damage, or even death. Page 257. As you might expect, certain parts of the body are more easily injured than others. The brain and the spinal cord are very fragile and easy to injure. Fortunately, they are protected by the skull, the vertebrae, and several layers of soft tissues. The eyes are also easily injured. Even small forces on the eye may result in serious injury. The bones in certain organs are stronger and can absorb small forces without resulting injury. The net result of this information is that you can use the mechanism of injury, or MOI, as a kind of guide to predict the potential for a serious injury by evaluating three factors: the amount of force applied to the body, the length of time and force that was applied, and the areas of the body that were involved. Let me say that again. The amount of force applied to the body, the length of time the force was applied, and the areas of the body that are involved. You will commonly hear the terms blunt trauma and penetrating trauma. With blunt trauma, the force of the injury occurs over a broad area, and the skin is usually not broken. However, the tissues with organs below the area of impact may be damaged. With penetrating trauma, the force of the injury occurs at a small point of contact between the skin and the object. The object pierces the skin and creates an open wound that carries a high potential for infection. The severity of injury depends on the characteristics of the penetrating object, the amount of force or energy, and the part of the body affected. Let me say that again. The severity of injury depends on the characteristics of the penetrating object, the amount of force or energy, and the part of the body affected. As an EMT, you will also care for many medical patients. Medical patients are patients who require EMS attention because of an illness or conditions not caused by an outside force. For medical patients, you must examine the general type of illness the patient is experiencing, or the nature of illness, NOI. Let's be clear here, not MOI, but NOI. There are similarities between the MOI and the NOI. Again, there are similarities between the mechanism of injury and the nature of illness. Both require you to search for clues regarding how the incident occurred. You must make an effort to determine the general type of illness, which is often best described by the patient's chief complaint. The reason EMS was called: to quickly determine the nature of illness, talk with the patient, family, or bystanders about the problem. But at the same time, use your senses to check the scene for clues as to the possible problem. You may see open or spilled medication containers, poisonous substances, or unsanitary living conditions. You may smell an unusual or strong odor, such as the odor of fresh paint in a closed room. You may hear a hissing sound, such as a leak from a home oxygen system. Keep these observations of the scene in mind as you begin to assess a medical patient. Be aware of scenes with more than one patient who are exhibiting similar signs or symptoms. An example would be an elderly couple experiencing flu-like symptoms, headache, nausea, and vomiting. These symptoms may be indicative of carbon monoxide poisoning, which would be an unhealthy situation for you and your partner as well. The importance of the mechanism of injury and nature of illness, or the importance of the MOI and NOI. Considering the MOI or NOI early can be of value when preparing to care for your patient. For example, when you begin to gather equipment from the unit to treat your patient, what would you take for an older patient complaining of chest pain? How would that equipment differ from the equipment used for a pedestrian struck by a vehicle? The appearance of the scene may also guide you in your preparation. Other MOIs may include motor vehicle crashes, assaults, stabbings, or gunshot wounds. Examples of NOIs include seizures, heart attacks, diabetic problems, and poisonings. Family members, bystanders, or even law enforcement personnel may also provide important trauma or medical information to help you assist the patient. During the pre-hospital assessment, you may be tempted to categorize your patient immediately as a trauma or medical patient. Remember, the fundamentals of a good patient assessment are the same despite the unique aspects of trauma or medical care. If an unconscious patient is found at the bottom of a ladder, did he fall off the ladder, strike his head and become unconscious, or did he experience a medical problem that caused him to fall off the ladder and then lose consciousness? Early in the assessment, it can be difficult to identify an absolute certainty whether the problem is of a traumatic or medical origin. Although further assessment is needed to come to a conclusion, consider the MOI or NOI early. Considering the MOI or NOI early will help you prepare for the rest of your assessment. Take standard precautions. Standard precautions and personal protective equipment, PPE, personal protective equipment, or PPE, need to be considered and adapted to the pre-hospital task at hand. Personal protective equipment includes clothing or specialized equipment that provides protection to the wearer. The type of PPE used will depend on the specific job duties required during a patient care interaction. For example, firefighters may wear PPE such as steel boots, helmets, turnout gear, gloves, heat-resistant outerwear, and self-contained breathing apparatus designed to protect them from injury when performing a forced entry. Hazardous materials technicians may don a protective encapsulated suit designed to prevent contamination by potentially lethal hazardous materials. Standard precautions. Standard precautions are protective measures that have traditionally been developed by the Centers for Disease Control and Prevention for use in dealing with objects, blood, body fluids, and other potential exposure risks of communicable diseases. We are on page 258. If you have a primary responsibility for patient care, you will need to follow standard precautions when receiving the call for help. It is a standard required in each and every patient encounter. These measures may not provide absolute protection from exposure to infectious diseases or blood-borne pathogens, but they are the most effective way to reduce a provider's risk of exposure. The concept of standard precautions assumes that all blood, body fluids, except sweat, non-intact skin, and mucous membranes may pose a substantial risk of infection. Remember the saying when dealing with body fluids in patients: if it's wet, it's infectious. When you step out of the EMS vehicle and before actual patient contact, standard precautions must have been taken or initiated. See Figure 8.4. After you have contact with a patient, it will be too late to think about what precautions should have been considered. The use of standard precautions in EMS, including but not limited to consistent hand washing with soap and water or with disinfectants, gloves, eye protection, a mask, and a gown may be dictated by local standards or protocols. At a minimum, gloves must be in place before any patient contact. Remember that after contact with a patient, gloves may be contaminated by infectious materials, so consider this when handling EMS equipment. When the same gloves used during patient contact are used, the use of eye protection may be necessary during patient interactions. Standard eyeglasses may not offer enough protection because most are not designed with side splash guards. For that reason, eyewear should protect you from potential exposures from many different directions. Blood and body fluids that contain potentially infectious materials may become airborne. Therefore, you should consider wearing a mask. A mask will provide protection from some airborne diseases, but its level of protection will depend on the type of mask, proper fit, and your ability to apply and wear it properly. You must be appropriately educated in the use of standard precautions, which should include training in the many types of PPE used in different situations. If you are not trained in the application of PPE, you should not approach a scene or make patient contact, but should call for additional help. Determine the number of patients. As part of the scene size-up, it is essential that you accurately identify the total number of patients. This evaluation is critical in determining your need for additional resources, such as firefighters, specialized rescue groups, a hazmat team, or additional ambulances. When there are multiple patients, you should use the incident command system. When there are multiple patients, you should use the incident command system. Call for additional units, and then begin triage. Triage. Look at figure 8.5. The incident command system is a system implemented to manage disasters and mass casualty incidents in which section chiefs, including finance, logistics, operations, and planning, report to the incident commander. Triage is the process of sorting patients based on the severity of each patient's condition. Once all patients have been triaged, you can begin to establish treatment and transport priorities. Usually the most experienced EMT is assigned to perform triage. This process will help you allocate your personnel, equipment, and resources to provide the most effective care to everyone. When a large number of patients are present, or there are more patients than the responding unit can effectively handle, you should put your mass casualty plan into action based on your local protocols. You should be familiar with the incident command system and understand your local protocols. Consider additional or specialized resources. Some trauma or medical situations may require more ambulances, whereas others may have a need for specialized resources. Basic life support units may be all that are needed for some patients. However, advanced life support, or ALS, should be requested for patients with severe injuries or complex medical problems depending on available resources and local protocols. The ALS may be provided by AEMTs or paramedics, depending on how your EMS system is set up. Air medical support is another good resource for ALS. Follow your local protocols in requesting ALS resources. Many resources in addition to fire suppression are often available through the fire department, including high-angle rescue, hazardous materials management, complex extrication from motor vehicle crashes, water rescue, and other specific types of rescue, such as swift water rescue. Look at figure 8.6. Specialized equipment and gear will also be needed for each of these situations. Search and rescue teams can be helpful in finding, packaging, and transporting patients over long distances or across unusual terrain. Law enforcement personnel may also be needed to control traffic or intervene in domestic violence situations. Many police departments throughout the country have their officers trained as first responders. They know cardiopulmonary resuscitation, or CPR, and may even carry an automated external defibrillator, an AED. In the perfect situation, law enforcement personnel should be the first to enter crime scenes and hostile environments. You should stage yourself and your vehicle at a safe distance until the scene has been secured. If any situation presents itself as a danger to you, your partner, or patient, you must retreat to the safety of the EMS vehicle. Be aware of the potential for danger. Be aware of the potential for danger at all times and understand when additional or specialized resources are required. To determine if you require additional resources, you should ask yourself the following questions. How many patients are there? What is the nature of their conditions? Who contacted EMS? Does the scene pose a threat to you, your patient, or others? Knowing how your EMS system is organized will help you determine the additional resources that may be required. The sooner these resources are identified, the sooner they can be requested. Pause and move on to the next video. If you need to, get up, get something to eat, use the bathroom, or at least just stand up.